All right, let's dive into a really revolutionary vision for global healthcare. It was born out of a crisis of cost in India, and it's basically a playbook for how to do something no wealthy nation has ever managed to do: completely separate healthcare from how much money you have.
I mean, just think about that for a second. That's the reality Dr. Devi Shetty, who's a world-renowned cardiac surgeon, faces every single day. When a mother asks him, how much will it cost to save my child's life? Well, whatever he answers becomes that child's price tag. It's a brutal calculation, and it's what fuels his entire mission.
So, to really get what he's trying to do, we first have to understand the incredible scale of the problem. And we're not talking about small gaps in the system here. These are absolute chasms.
Check this out. A huge number of deaths around the world aren't from some complex, incurable disease. No, they're from things like a burst appendix or needing a C-section during childbirth, really basic procedures that millions just can't get. It leads to 17 million preventable deaths every year. And if we zoom in on India, the scale of this is just staggering. To meet the population's basic needs, the country needs about 70 million surgeries a year. But the reality? They're only performing 20 million. That leaves a gap of 50 million surgeries every single year.
And behind these giant numbers, there's a really profound social tragedy. Because Indians are genetically prone to heart attacks at a much younger age, often in their 40s. The country is left with this enormous number of young widows and fatherless children, all from a condition that is treatable. So, faced with this crisis, Dr. Shetty developed this core principle that guides every single decision his organization makes. It's a really simple, but honestly a radical new philosophy for health. This one sentence is the foundation for absolutely everything. It's not about making a slightly cheaper version of a Western model. It's about completely rethinking healthcare delivery from the ground up, with affordability as the absolute non-negotiable starting point. So how does a philosophy like that actually turn into action? Well, it becomes this multi-pronged strategy, a real playbook for disruption that tackles the problem from every angle. And it focuses on three key areas: trust, technology, and talent. First up, trust. Dr. Shetty realized the system is broken because fundamentally, nobody trusts anybody else. Patients don't trust hospitals or insurers. Insurers and hospitals don't trust each other. So what's the fix? You have the hospitals become the insurance providers themselves. All of a sudden, the incentive isn't to do more surgeries, it's to keep people healthy. And this isn't just a theory. They put it into practice with incredible results. The Restate program, 1.7 million farmers pay just 5 rupees a month. That's less than 10 cents. But that tiny sum, when you pull it all together, was enough to fund over 60,000 heart operations. It just goes to show you that even the smallest contributions, when they're united, can have enormous power. Okay, next up is technology. Dr. Shetty argues that the next big leap in patient safety isn't going to be a new pill or some fancy scanner. It's going to be new tech. He points to the US, where medical error is the third leading killer. And he believes that this is fundamentally a data problem that you can only solve with a digital platform. And this is where he believes India can actually leapfrog the outdated technology in the West. While American hospitals are kind of stuck with these billion-dollar electronic medical record systems built for desktops, his team built a platform for the tool doctors use 200 times a day: their mobile phones. It's affordable, it's nimble, and get this, they give it away for free to charitable hospitals. This radical idea suggests that in the future, technology, not big physical buildings, will be the most valuable asset in healthcare. I mean, think about it. Airbnb owns no hotels. Amazon started with no storefronts. The healthcare giants of tomorrow, they're going to be software companies. So the final piece of this playbook is talent. But it's not about finding new people. It's about unlocking the potential that's already there, hiding in plain sight. Imagine turning underutilized government hospitals into massive training centers. Imagine changing the rules so the best practicing surgeons can also be the best teachers. And imagine extending the care team all the way into the patient's home by training family members to be post-operative caregivers themselves. So all these innovations in finance, in technology, in talent, they all build towards this one final, really audacious goal for India's role on the world stage. And here it is. This is the grand prediction, that India will achieve what no other large, wealthy country, not even the United States, has managed to do: making quality healthcare accessible to every single citizen, regardless of their ability to pay. And this isn't some 50-year dream. The prediction is that this can actually be achieved within the next decade, in as little as 5 to 7 years, because the momentum and the policy changes needed are already happening.
So, what's the economic engine for this whole global vision? It's to train so many doctors and nurses that they literally become healers for the world. The goal is to generate $100 billion a year in remittances. That's money sent home from Indian healthcare professionals working abroad. But here's what's so transformative about this economic model. It's where the money goes. This isn't corporate profit for shareholders. This is $100 billion flowing directly into the pockets of millions of poor rural families, fundamentally changing entire communities from the ground up. So, Dr. Shetty's playbook offers a really compelling argument that it can be. By starting with this extreme constraint of affordability, India might be forced to innovate in ways that the rest of the world simply hasn't. And that leaves us with a really powerful question about where the next great ideas will truly come from.